Hello, I'm Dr. Rohini. Today I am going to talk about flight travel in pregnancy. So the first question, is flight travel safe for pregnant women? Yes, it is safe. There are certain situations where we do tell the patient to avoid traveling. That is when the hemoglobin is less than 7.5 or the patient has sickle cell anemia or when the patient has any risk of abortion. In these situations, or if patient has had a fracture, in these situations it's better to avoid traveling. Now, in which period from when to when you can travel safely? So, as such, there is no restriction for traveling in the early pregnancy. But yes, in case you have had previous miscarriages or previous abortions, or in this current pregnancy you have had history of bleeding or history of or risk of abortion, then it's advisable not to travel in the early pregnancy. Now, towards the end, it's advisable not to travel after 32 weeks of pregnancy. That is there because after 32 weeks, there is a risk of delivery. There is increased chances of delivery. It's better to avoid after that period. And in case if you already have a risk factor where the doctor has told you that you are at a risk of delivering before time, then it's better to avoid air travel altogether. When you go, what to do and what not to do during the travel period. So first of all, when you go to the airport, first is the body scanners, that X-ray scanners, are they safe for pregnant women or not? So yes, there is some minimal radiation through the body scanners, but they will not affect the baby. So it is safe to go through those body scanners. If you're traveling to some place, you should make sure that you are in touch with a gynecologist or a doctor in that particular place. So in case of emergency, when you go during the travel period, you can contact a doctor. And if you're going to a place where you're prone to get some infections, then take the appropriate vaccination. And if you're going for an international travel, make sure you have your health and travel insurance. So next, what are the precautions that you have to take when you are in the flight? So first of all, book an aisle seat. And when you are putting the belt, make sure that it is below your baby bump. And keep doing exercises when you are sitting on your seat. Every 30 minutes, keep moving your legs up and down. And make sure that every 1 hour you get up and you walk around the flight a little bit. And then you come back. Keep yourself well hydrated. Avoid caffeine. So avoid coffee or any soft drinks. In case if the journey is more than 4 hours, then it's advisable that you wear compression stockings, or you can also take some blood thinner injections like heparin. So these precautions are usually told because in pregnant women there is increased chance of a condition called deep vein thrombosis, that is chance of clot formation in the veins of the leg and in the lungs. So to prevent this, these precautions have to be taken. So these are some basic precautions. I hope I was clear in explaining what to do and not to do during a flight travel.